Welcome to section 20.1 of Metabolism. In this video, we will focus on memorizing the details of thiamine, or vitamin B1. So let's get started. Our setting is a military training camp secluded deep in a heavily forested area. The men of this camp are very focused on strengthening their thighs. All of these thigh men are currently engaged in an obstacle course race of sorts. The start of the obstacle course is here in the back with the yellow sign noted START. Now let's introduce our first contestant in this thigh man race. As you can see here, he does have massive thighs. Notice that he comes in first place. In fact, he is holding his fingers up as though he is number one. This will help you remember that thiamine is vitamin B1. I guess he is number one, so we won't hold it against him that he is gloating a little bit. Now, thiamine is necessary for many enzymes to function properly. The first enzyme I will introduce is transketolase. This man right here is obviously training. He is pretty ripped, so it's likely that he has been training for many years. The fact that he is training will remind you of transketolase, or transketolase. It is very important to remember this enzyme. It is present in red blood cells. If a person gets more thiamine in their system, this enzyme in the red blood cells, or in other cells throughout the body, will be upregulated. This makes sense because the enzyme got more substrate to operate. Now, B1 or thiamine is required for the proper function of many other enzymes. Now look at this thigh man crawling across a chain of branches. This branch obstacle represents branched chain keto acid dehydrogenase. Overcoming these sharp branches is likely super uncomfortable for this guy, but it definitely helps solidify that thiamine is needed for branched chain keto acid dehydrogenase. You may have noticed that I didn't say the alpha part of this enzyme's title. Remembering this enzyme as a branched chain keto acid enzyme becomes even more helpful when it comes to the next enzyme whose title starts with alpha. The next important enzyme is involved in the TCA cycle, as you can see here by the tricycle. TCA cycle, tricycle. To be riding a little tricycle like this is likely embarrassing for this guy, but I guess that just adds an additional challenge to the obstacle course race. So what enzyme within the TCA cycle are we focused on? Alpha-ketoglutarate dehydrogenase. This guy is wearing a bandana with an alpha symbol on it. He also has a necklace with keys on it. Alpha-ketoglutarate dehydrogenase. Since he is on the embarrassing tricycle, hopefully you will remember that alpha-ketoglutarate dehydrogenase is involved in the TCA cycle. Unfortunately for this tricycle guy, he has bigger problems than being embarrassed. The camp has just been invaded by some modern-day pirates. These pirates will help you remember pyruvate dehydrogenase. Apparently, they aren't going for a kill shot since they are aiming at the tires of the tricycle. This will help you remember that pyruvate dehydrogenase is connected to the TCA cycle. In fact, pyruvate dehydrogenase is connected to glycolysis as well as the TCA cycle. And to represent glycolysis, we have this glass shattering from the window here. So glass shattering, glycolysis. The pirates break the glass and shoot the tricycle. So pyruvate dehydrogenase connects glycolysis to the TCA cycle. Now this image is discussed in great detail throughout the chapter. Now let's look at the TCA cycle really quick. This is a more detailed image of the TCA cycle, and it's discussed in great detail in the TCA cycle lecture. Now notice that thiamine is represented by this green dot. So you can see that thiamine is needed for alpha-ketoglutarate dehydrogenase to work. Now let's bring your attention to acetyl-CoA. Going back to the main image, we see that acetyl-CoA right here comes from pyruvate right here. And this image provides more detail and shows that pyruvate dehydrogenase needs thiamine to make acetyl-CoA for the TCA cycle. So we have pyruvate right here, and the enzyme pyruvate dehydrogenase requires thiamine, which in this image is represented by an orange dot right here. When it has thiamine, it can effectively make acetyl-CoA, and acetyl-CoA can then go to the TCA cycle. So in this way, pyruvate dehydrogenase connects glycolysis to the TCA cycle. Now when you don't get enough thiamine, you can become thiamine deficient. Now this cage here is where our prisoners of war are detained, and all of the POWs in this cage are thiamine deficient. For example, this POW right here. Look how emaciated and malnourished he is. Being malnourished, like this guy, and not getting enough nutrition and vitamins such as B1 is one way to become vitamin B1 or thiamine deficient. Now the guards aren't completely cruel. In fact, they give the prisoners a diet full of berries. This will help you remember a condition known as beriberi. There are two forms, wet beriberi and dry beriberi. This weak prisoner will represent dry beriberi. In the dry version, there is symmetrical muscle wasting, as you can see from his wasted muscles. There is also polyneuropathy, which means neuropathy, or damage to nerves in many areas. The biggest thing I want you to focus on is that you can lose sensation. Notice how he is grabbing onto a barbed wire fence and doesn't seem to feel any pain. Now look closer at the barbs. These actually look like myelinated neurons. So when you think of dry beriberi, think of this weak POW with muscle wasting and polyneuropathy. Now let's discuss wet beriberi. Notice that this prisoner is getting fed berries and he is actually allergic to them. As a result, he is puffing up quite a bit. This represents edema. The edema in wet beriberi occurs as a result of heart failure. Notice he is even grabbing his chest in agony. Now look at this big hole here in the fence. Unfortunately for this puffy edematous prisoner, a car crashed into the fence. I say this is unfortunate because the crash likely injured this man. You can even see his leg is up on the hood of the car. Now this damaged car represents dilated cardiomyopathy, to further emphasize the role heart failure has in wet beriberi. Now this car didn't drive itself into the fence. As you likely suspected, the driver was drunk, and you can see all of the beer and beer bottles spilled out of the car. This will help you remember that alcoholics are prone to develop thiamine deficiency. Now we will discuss Wernicke-Korsakoff syndrome. This is caused by thiamine deficiency. This alcoholic is getting a walking test from one of our thigh men. Notice that he is falling. This will help you remember that ataxia occurs in Wernicke-Korsakoff. If you look closely, you will also see his eyes darting around. This helps you remember that ophthalmoplegia is also present in Wernicke-Korsakoff syndrome. These patients have personality changes and memory loss. This guy even forgot how to walk. Anyways, Wernicke-Korsakoff syndrome occurs when the mammillary bodies of the brain are damaged. Notice these dead mammal bodies hanging here. I guess the soldiers are planning to eat them. I guess they gotta get food somehow deep in the forest. Now these mammal bodies will help you remember mammillary bodies are damaged in Wernicke-Korsakoff syndrome. To reinforce the fact that mammillary bodies undergo necrosis and hemorrhage, we have added this blood dripping from the hemorrhaging mammal bodies. And with that, we've concluded all the details of thiamine and thiamine deficiency.